Hi guys, welcome to another Your Health is Lit session. I'm Charlotte Walker, aka the PDMP.
I'm Donna Williams, aka the Public Health Queen.
And I'm Dr. Tamia Austin, aka Dr. Tamia Austin.
So this is our sickle cell disease awareness session. When sickle cell came up, well, when me and Charlotte was talking about sickle cell, the first person that popped to my mind was Dr. Austin. Me and Dr. Austin was in the public health program together at FAMU, and I just know that you have a passion for sickle cell ever since we were at FAMU. So I was like, I know the perfect person who's going to nail this session. So if you can just give us a little bit of background about you, Dr. Austin.
Well, so I will qualify that I am aka the sickle cell trait education lady. I came to FAMU with a burning passion to find a way to add some credibility to my passions, seeking a public health degree. And was through much tribulation and trial, which I know you know, was able to persevere and completed a dissertation that was a social ecological examination of sickle cell trait knowledge amongst coaches, trainers, student athletes, and their parents at a historically Black college and university in Florida. That research really solidified something that I had suspected. Of course, you're not really supposed to go to the research with an idea in mind, but ultimately it showed us that sickle cell trait knowledge is not as vast as it should be. And the fact that I had been working for a foundation that was started by a young man who has sickle cell trait, who lost his brother to sickle cell trait exertion, it just fueled that fire in me to discover and research ways to help people know that, yes, sickle cell disease is very important. It does cause its warrior community a lot of pain and crisis and even early death. But sickle cell trait is considered a benign condition in the research, but there are adverse health effects even unto death and even a cancer that's associated that too many people don't know about. And that's what I'm all about these days. Is it consumes me and willingly, just to get the message out. And so my hashtag on a very daily basis is hashtag sickle cell trait education.
Perfect. So I think Charlotte has a question for you.
So I know that, I'm a pediatric nurse practitioner. So I see a lot of these babies and I make sure, we put on their problem list, like, mom has sickle cell trait, dad doesn't know if he has sickle cell trait, or they may have like the full-blown disease. So for our listeners that don't know, would you mind just educating on the difference between having the full sickle cell disease versus just being a carrier with the trait?
Okay, and I will be sure to qualify everything that I'm saying, because I think a part of the reason why we have the knowledge gaps that we have is because of the language that we use. So I am diligent about saying that sickle cell trait is full-blown sickle cell trait and sickle cell disease is full-blown sickle cell disease, just to try to get people to think about the fact that it is not, oh, just a trait, because there are adverse health effects associated. So with that said, sickle cell disease, it is the most common genetic blood disorder in the world. It is something that you are born with. You're given it by your parents. It is a genetic inheritance. When you have sickle cell disease, you have inherited an abnormal hemoglobin gene from each of your parents. That's often referred to as SS. If you have sickle cell trait, you have inherited one abnormal hemoglobin blood gene from one of your parents. When you have sickle cell disease, I believe it's since 2005, maybe it's 95. There have been newborn screenings, mandated newborn screenings throughout the United States. And based on that surveillance, there's somewhere between 90 to 100,000 people in the United States that have sickle cell disease. I believe we're told that 1 in every 365 births is a sickle cell disease birth. And those people are treated early with fetal hemoglobin to try to increase life expectancy, because especially in the earlier years or less recent years, it cut down life expectancy where children weren't living past 14. That age has now increased, and we have people in the sickle cell disease community that are living well into their 70s, 80s, 90s, and even hundreds. But it can be mitigated, managed with nutrition and health practices, but they often suffer with severe pain crisis, because those sickled cells, wherever they sickle, whether it's in their eye, wherever you have blood, your blood cells can sickle, and that sickling makes the blood cell go from a nice round, plump shaped blood cell to more constricted and sticky, and often described as the shape of the sickle tool. And that sickling makes them stick together and form clots. And those clots can form wherever blood forms, in the eye, in the heart, in the leg, and sometimes often causing organ loss, such as spleen loss, sometimes stroke, but severe pain crisis. And unfortunately, a lot of sickle cell disease warriors are often considered to be drug seekers, because they have such a high tolerance for the narcotics that it just seems unrealistic that you would need this much pain meds to manage your pain. But I've heard it described as taking a rubber band and wrapping it around your finger until the point that you can't take it. That is how some of them describe their sickle cell pain. Others describe it like taking a nail and that's like banged into a piece of wood, and just taking that nail and just banging it into your legs. It is excruciating pain that, unless experienced, it is unimaginable. But often the side effects of the use of the narcotics and the other things that are processed through the liver cause secondary effects. So it's not a walk in the park by any means, but there are definite warriors that are surviving. Sickle cell trait, on the other hand, depending on the amount or the percentage of abnormal hemoglobin, can cause a person to live what is described as a normal life, a pain-free life. But often we're hearing more and more that people living with sickle cell trait are having trait crisis pain that is sometimes described as cramps, or sometimes described as growing pains. And that is because they have that one abnormal gene that causes their blood to sickle. And when their blood sickles, it sickles wherever it sickles, and that can cause a clot, that can cause pain, that can cause throbbing and aching. And even in some trait carriers, sickle cell it is also associated with a renal medullary carcinoma, which is a kidney cancer. So there's a whole lot more research that has to be done, but ironically, this is the result of that natural selection in malaria endemic countries as protection. And now the protection is really only available to those that carry the trait, not necessarily the disease. It can still kill those with disease, but the United States is not a malaria endemic country, so there's other things that those trait warriors, as I call them, end up having to deal with. And of course, hydration, elevation, and exertion are the three things that I preach as the main risk factors associated.
So, who should be tested for the sickle cell disease, and is there a particular group that is most likely to be affected by this more than another demographic or group?
Well, okay, so sickle cell disease and sickle cell trait can affect anyone, and I mean anyone, especially those of African, Latin, Asian, Indian, Italian, Irish, Greek, Turkish, or Mediterranean descent. Migration, mixed race births, or anything has basically resulted in there being no pure anything anymore. I know people that identify as white that have sickle cell disease. I know people that identify as white that have sickle cell trait. So if you're intelligent enough to accept that this is not a skin color thing, this is a bloodline thing, and if you know your blood inheritance is, or blood heritage is Irish or part Italian or part Greek or Turkish, you should get tested. It's just as plain as that. There are varying levels of testing for sickle cell. We recommend that you go to a doctor. Now, if you have sickle cell disease, it's highly likely that you are aware. Um, but if you have trait, it's highly likely that you might not be aware. I counsel with hundreds of parents who have told me they did not know. Both parents having sickle cell trait birthed a child with sickle cell disease, and in a lot of cases there have been severe crises experienced by their children. And some parents have said, had I known, I wouldn't have pursued childbirth with this partner. So
Wow.
everyone needs to be tested. Everyone needs to just know for sure, rule it out. As much as we talk about HIV and AIDS and all of that, sickle cell is right up there.
So I know you talked about like hydration, exertion, and those kind of things. How does having sickle cell disease or sickle cell trait like affect people in their day-to-day lives?
Okay, I'm gonna give you guys this spiel every time I do a presentation. I ask people to think about the fact that we put water in our cars, we give water to our pets, we water our plants. Why? Why do we do that? And I'm asking you.
Oh, for hydration.
Hydration.
We want
They
to
need
keep
water to live.
we want to keep our dogs from getting lethargic. We want to keep our plants from dying. We want to keep our cars from running hot. So what if I told you that in order for a human, sickle cell trait or not, sickle cell disease or not, but in order for a human, especially women, to not be dehydrated, we have to consume half our body weight in ounces of water a day. This is a newer school approach to hydration to the old approach, which was 8 glasses of water a day.
Right.
This is more customized. So based on your weight and of course activity, but weight kind of keeps it more customizable. If you weigh 200 pounds, how many ounces of water should you be consuming a day?
100 ounces.
Okay. If you weigh 300 pounds, how many ounces of water should you be consuming a day?
150 ounces.
Okay, very simple. And that is to avoid dehydration. And so then I often ask the audience, okay, based on that formula, how many of us are dehydrated right now?
Right.
And most people raise their hands. I mean, usually it's a room full, and that is because dehydration is chronic. We don't know all that dehydration does, but we do know that hydration is important for good blood flow. It's good for good elimination and bowel elimination. It's good for good skin. Hydration, of course, helps you feel less lethargic. It keeps you from overheating and running hot. One of our mottos at the As One Foundation, where I'm the executive director, is if we sweat it out, we put it back. It's a reason why we feel thirst. It's a reason why sometimes you can drink a soda, you can drink a Gatorade, but there's nothing like sometimes just drinking that water. And the reason is on a very basic basis, your blood is pushed through your veins via hydration. That is how your oxygen is supplied throughout your body. And for people with sickle cell disease and sickle cell trait, those blood cells reproduce 50% slower than a normal blood cell. So if it takes 60 days for your blood cells to regenerate in a normal person with normal hemoglobin, it's taken double that amount of time for a person with trait or a person with disease. So when you are exerting and you're putting out more, your body as a trait carrier or as a disease person is going to work harder and need more time to regenerate. And in the case of sudden death by sickle cell trait, that is not being allowed to happen. Your body is trying, but it is not working optimally because there is that slowdown, that 50% slowdown. So hydration is important for any of us, sickle cell trait or not. But when you imagine a person that needs that times two, they need that, recovery times two, they need to be able to take some breaks times two and even more, and they're not getting it, something is going to go awry. And if you think about a car that runs hot, those parts just lock up and that car starts spewing and then is overheating and it might catch fire or it might just stop. And that's essentially, your body is a system of systems that are trying to go, but they need that water to help it go. And it's not there. It's just not there. So the hydration helps to move it along. It just like I heard a sickle cell disease person say that they do yoga. They might, do meditation and breathing just to try to continue the blood flow. And that's majorly important in people that have sickled cells.
Yeah. And even when talking about, the length of time, I think that, like, for us and like me in general practice, the couple things that they teach us about, sickle cell disease and kids with sickle cell trait. The sickle cell trait kids, we monitor them, right? But then we do know and are taught that they may present with some type of manifestation similar to patients with sickle cell disease. And it goes like this: pain management, hydration, oxygenation, and I'm gonna send you like those three things I know. But the normal like red blood cell is 120 days. That's 4 months. So for a patient with sickle cell, it takes 8 months for them to get cells. So that's definitely really like eye-opening. So people, it'll take almost a year. What our body does in 4 months, it takes almost a year for patients with sickle cell to get brand new red blood cells. So that's definitely something that
I think that's great that you're even taught that, because I've been told by medical school students that they get the equivalent of approximately a paragraph within a week of genetic studies on sickle cell disease and the equivalent of about 5 minutes on sickle cell trait. So here you have a whole host of medical, clinician practitioners that don't even know what they need to know about sickle cell disease and sickle cell trait. And it often, leaves them ill-equipped, and certainly leaves a patient feeling, on the sickle cell trait side, feeling like they're lying, they're making it up. You must be crazy. There's nothing wrong with people that have sickle cell trait. And the disease people who have either built up a tolerance to higher dosages of pain meds are looking like drug seekers, because what am I going to do with a 0.5 milligram? I need 3 milligrams.
Right.
But with the medical community not fully armed with a good set of knowledge about it, it just creates that constant tug of war that we as community-based organizations are trying to demolish. We really are trying to raise the IQ of our clinicians and our practitioners, but also the community through universal precautions, universal education. Let's just educate everybody the same way everybody gets educated in October for breast cancer. We're just needing to educate everybody. Because as far as I'm concerned, there's 300 million people in the world that need to understand this. And until I can go to any corner of this earth and get good information about sickle cell trait, not just the street committee, but really good, accurate, but people understand this is not a skin disease, a skin color thing, this is a bloodline thing, then that's work. That's work for us to do, more work for us to do.
So I know some things that we've been seeing in the news is the sickle cell and the athletes about the dehydration and stuff. So what's going on with that? Is there education going on? What are we doing to stop this or bring light to this?
Well, okay, so exertion, elevation, and dehydration, those are the three main risk factors that are associated with sickle cell trait and these sudden death events or exertional events, as they're called. Very recently, I believe since May, there have been 3 collegiate athletes, and I'm so very disappointed to say there have been 3 that I know of. I'm sorry, 4 middle or high school athletes that have died. All of the coroner's reports are not in, but we know that there has been some association of exertion. We have had no confirmation of sickle cell trait to date, but going back to that formula of exertion and hydration and what is needed, but if you are thrust into a culture that associates water with weakness, even to the point that the young athlete has decided that I don't need water, I'm tougher than that, I'm going harder. This is the 4th quarter against Miami or whomever my rival is. Am I going to get water or am I going to go harder? And that young athlete is going to choose against his or her own body, going to choose against his or own body messages, something that's saying, I need to stop, I need to rest, I need to take a knee, I need to put my hands on my hips, I need to raise my arms above my head to let air into my lungs. I'm not going to do that because I'm not weak. I'm going through this wall. And that is unfortunately what continues to happen. Yes, education is happening. It's not happening fast enough, and it's not happening widely enough. A community-based organization, I can tell you, we are not extremely well funded. We are usually a whole bunch of passionate people that have experienced a close loved one death or something like that, and we are just devoted to, getting the message out. But often we are robbing Peter to pay Paul to fund our passion. So and the unfortunate thing is these athletes are people. They're young men that should have grown up to be fathers and grandfathers and business owners and community activists themselves. But there is a culture that only sees them as a product, that sees them as a machine, that sees them as an animal, that sees them as beasts. And they themselves see themselves as beasts, and that's how they try to perform. But they are humans with organs, with blood, and they need water. So this type of education is far and few between. It's not happening enough, and unfortunately, we keep experiencing these pre-season funerals. We keep experiencing these premature deaths that, especially on the sickle cell trait side, I believe are 100% preventable. If you allow all athletes, single no one out, if the temperature is this high and we're going to be in full pads today, then everybody's going to drink this much water every this many minutes, and everybody's going to take this amount of rest. No questions asked, everyone's going to do it. That way you catch anybody that might have a heart issue, or anyone that might have a sickle cell issue, but all of us that are just regular, we're saved too. But you put these young people into these extreme situations with lacking, necessary information that they need, and you have these athletes that are dying unnecessarily, preventable deaths.
I definitely agree. I think that, conversations like these, like I didn't even think about, all of these athletic programs. And, I see a lot of these kids in office, and I'll have to look, and I'll post it in the group, but for our state, whether or not having sickle cell trait or sickle cell disease is on our sports physical exam, because we have a list of questions. I know that like heart conditions and asthma. We ask all of those things, but I'm interested to look. So I'll definitely have to take a peek tomorrow. I've always been taught outside of the sports, and particularly in our community, a lot of these kids that live in these, in toxic stress environments, it can exacerbate their sickle cell disease. So it's more than just, the kid out playing football. It's the kid who, mom works 3 jobs, and so they're in charge of all of their siblings. And, it's that toxic stress that you don't even think it's a bad thing. It can exacerbate their sickle cell, and now they're back in the hospital in another crisis. So it's really important to evaluate those things. I feel like because you can't see, sickle cell disease, people think these kids are fine, they can do whatever. I was at a seminar of some sort. I can't remember where it was, but the nurse practitioner was saying that she had a patient with sickle cell disease, and she was like, he was a little bit of shorter stature, but anything would set him off. And she's like, I had to tell him, like, you need to get your anger under control because it literally is killing you. So just being aware of their limitations and some of the, for our parents out there with kids with sickle cell trait and disease, making sure and like checking in with, with these kids, because they do try to go hard and teen no sleep and all that other, like, no. Get your sleep. You need to make sure you're hydrated and all of that. So that's definitely a really good point.
It's I just would like to also make this point that I've seen the statistics vary, but I've seen it at 7%, I've seen it at 18%, but there is somewhere between 7 to 18% of professional athletes, like in National Football League, that have sickle cell trait. So by no means am I saying that if you have sickle cell trait, you cannot engage in physical activity. In fact, I am saying the opposite. You can do whatever you want to do with the right set of information, with proper hydration, with, managing your exertion and understanding how your oxygen levels can be threatened based on your elevation, whether it's deep sea diving or mountain climbing. Some people with trait have issues flying. Whether it's they need to wear compression hose or get up and walk around to have the blood flowing. Everything, each patient, sickle cell disease or sickle cell trait, we describe them as snowflakes. As unique as a snowflake is from the next, there are no 2 snowflakes that are identical. Neither are sickle cell disease and sickle cell trait patients. Each one of them will have varying experiences, and that it's a very important thing for them to know, for them to understand the baseline of their condition, whether it's trait or disease. And we haven't even talked about beta thalassemia or alpha thalassemia or Monroe and all the other variations of this blood disorder, just like a person knows they need an asthma pump. And just to peek a little bit into my research, which was a full census mixed method study that utilized focus groups. So we actually got to hear and transcribe their words, the words of the athletes who said things like, I won't feel stigmatized if I have sickle cell trait, and I won't stigmatize my teammate. If he or she has earned their way out in that field, then they should be out there. I want my teammates to know, not only should I have been taught this in college, because that is the only time that the sickle cell trait test is mandated, other than the newborn screening. So there's no high school education about this going on, and there's no testing mandated in high school. There are some high schools that do it, but they're either extremely well funded, it's definitely a disparity issue there, but it should be. And the athletes said it. I should have learned this in high school. And then they went farther to say, this is something that shouldn't just be reserved for athletes. Sorority members, fraternity members, marching band, people in dance troops and dance clubs. They said all students need to know this. All students need to be tested, and every student should receive this education. And I agree. I absolutely agree. If nothing else, for really driving home the family planning information that we mostly get about it, which is 2 people with sickle cell trait, you have that 25% chance of birthing a child with sickle cell disease. But beyond that, how to take care of yourself. What is my hydration level? What is my elevation? What's going on with my exertion? I need to hydrate before, during, and after. And all of this, we teach it through the As One Foundation in our Operation Hydration Sickle Cell Trait Education program. But this is, we're covering the territory that we can, as much as we can, as fast as we can. And thankfully, through platforms like this, hopefully this extends our reach. But we got 4 million people in the United States to reach.
Right. Yeah, I definitely think more education. A lot of what I don't tell a lot of people, and what a lot of people don't know about me, is that I have the sickle cell trait, and so does like my twin sister, and my uncle died from sickle cell. So that's something that I really don't share a lot. But I can just remember growing up, my grandma and my mom would tell me how growing up with my uncle was very painful, because at night he would just cry and and he would just be like, he's in so much pain, and he lived, I hate to say it, but like the very painful childhood growing up because of the sickle cell. So yeah, definitely more education.